All right. Hi, everyone. So, welcome to Chapter 2 Assessment Process. So, today we're focusing on this assessment process. This chapter lays the foundation for how counselors think, not just what we measure. Okay. So, assessment is one of those topics that feels technical at first, but it shows up in every clinical decision you make, actually, every decision you make. So, our goal today is to understand the logic behind assessment, not just memorize tools. So, first of all, I want to get this into your head. Assessment is your clinical compass. It's not just a pit stop, it's not something you do at the beginning or the end of treatment. It's something that you're doing continuously and collaboratively with your client. It's deeply intertwined with counseling itself. From the first intake question all the way until termination, assessment is guiding our clinical direction. Think of assessment as a system that helps us move from concern to growth in a way that is intentional rather than reactive. So let's start looking at assessment methods. And we're going to look at the major ways that assessments differ from one another. If assessments have ever felt overwhelming, it's because people learn tools before they learn categories. So we're going to start with categories because categories give you mental organization, which make everything else seem easier. So there's three major distinctions. First, let's look at group versus individual. The first major distinction of assessments. Is it a group assessment or an individual assessment? Or the Costco model versus the boutique model? When you think of Costco, you think of big, right? Well, group assessments, they prioritize efficiency, like Costco, and screening, and massive screening. So group assessment is cost effective and practical in settings like schools or agencies that serve large populations, right? The trade off is that you are going to lose individualized observation with group assessment. You don't notice any hesitation, eye contact, anxiety, relational dynamics, etc. The individual assessment or the boutique model is going to prioritize depth and flexibility. You can adjust in real time based on the client's needs. And the trade off here is that you have a higher expense and it is time consuming. So it costs a little bit more and it's time consuming, but the trade off, right? So neither of them is better. Okay, they each serve a different purpose. I just want to be clear on that. There are moments when you'll use a group assessment, and there are moments when you'll use an individual assessment. But just so you know, that's one of the first major distinctions in assessments. Next, we have speed versus power. Does the assessment look at speed? Is it a whack-a-mole assessment? Or power, a rock climbing assessment? So speed tests are relatively easy items, short questions maybe or prompts, completed under a time crunch, a time pressure. They measure efficiency and processing speed. Power tests include items that increase in difficulty as you go, and they focus on how much someone can do rather than how fast they can do it. So this distinction matters clinically because a low score can mean very different things depending on which type of test you're using. So context is everything. So just to reiterate, the speed on the left side is the whack-a-mole. So again, it's about how many moles can you hit before the timer runs out, and then you win. Whereas the other side is rock climbing. So think about rock climbing, right? Initially, you start off and you're feeling brave and you're doing really good. And then as you're going, you're starting to get fatigued and tired, and you get to a point where you're like, all right, I gotta stop. Okay, so it's measuring your ability. All right, and the last major distinction between assessments is quantitative versus qualitative assessments. Quantitative assessments, they're going to focus on scoring numbers and norms. They are the top of the iceberg. It's going to give us the explicit information, and it's going to answer what is happening, right? Qualitative, it's going to focus on the memoir, the narrative, the meaning, okay? It's going to give us the implicit information. It answers, why is this happening? It's the under the surface, under of the iceberg, the underbelly of the iceberg. So strong assessment practices are going to integrate both of these, right? Because numbers without context is incomplete, and stories without structure is vulnerable to bias. So think of the quantitative side. You can think of a blood test, right? So quantitative assessment for iron, right? You get a score, your iron is low, all right? Or a qualitative, think of the memoir. So this is the narrative, the meaning, and the why. So if I tell you my heart rate is 140 beats per minute, that's quantitative. If I tell you it's because I just saw a spider the size of my dinner plate, that's the qualitative memoir I'm living in, right? That's my story. Good. I hope that helps. Now let's get into different types of assessments. Now that we understand the major distinctions, look at the specific types of assessments and methods that counselors are using in practice. We have about 3 of these slides here. So we have behavioral observation, and this involves systematically watching and counting behavior. This is not just like casually noticing. It's intentional and structured. So I call it the referee approach because we are counting what is happening. We're watching it, right? And then there are rating scales, and so they're commonly used, but they're very vulnerable to errors. Now, these errors are coming from us, so I want to point that out. The halo effect, that's the celebrity effect. So as we are assessing clients, we may see one thing we like about them and assume that they're an angel in every other category. That's the halo effect. I'm sure you can imagine the alternate side of that is called the horn effect. You can figure out why. Then there's the leniency error. That's the nice guy trap. You don't want to be the bad guy, and you don't want to give them a harsh label despite what the data is saying. And then there's drift and decay, where your just focus is drifting, right? Like a flashlight battery after, starts to fade after time. This is your 8th client and you're just starting to fade. So let this be a reminder that assessment quality depends on both the tool and the assessor. So self-awareness matters here. All right, continuing on with types of assessments, we have the physiological measures, so heart rate, breathing, blood pressure. They're going to give us the data that clients may not be able to tell us, right? So I call it the body's polygraph. It's the most honest data, okay? Is their heart rate pumping out of their chest, right? That's going to let us know what's going on with them. Are they emotionally flooded? Then we have body mapping, the ability to locate the trauma in the physical body. Where are you feeling this right now? Where is the pressure for you? Think of the body keeps the score, right? That looks at body mapping. And then we have projective techniques and card sorts, and those are trying to access meaning when a client can't find the words. All of those do require like specialized training and very careful interpretation. And they're wonderful when used responsibly because they can add depth, but used casually, they can cause harm. So make sure that you look into that specialized training with that. And then lastly, we have graphic methods like the genograms, which I'm a huge fan of. We'll cover this in class, and eco maps. And so that's like their social blueprint. These allow us to see their systems and their relationships. We have biographical methods such as biodata, lifelines, and self-characterization, which help identify patterns across time. And if you look below that, I told you what self-characterization was. The third person hack, so where you have your client write about themselves as a character, and that helps to bypass their ego defenses. So all of these assessments here are especially useful when you're working with identity, these groups here. So family systems and developmental history, if that is central to the presenting concern, then these are great assessments for that. Just a side note there. So now you know about types of assessments. Let's talk about the assessment process and see how all of these different pieces of the puzzle fit together to make a coherent process. So first things first, and most important thing is a client's state of change directly influences which assessment is appropriate for them. Okay, so we have pre-contemplation. I'm not even thinking about it. Contemplation, preparation, I'm preparing to make a change. Action, I'm actually making the change. Maintenance, I've made the change and I'm maintaining that change, okay? So depending on where they are on that continuum, that's gonna affect what assessment you're gonna use and what assessment is appropriate for them. So someone in pre-contemplation may benefit from exploratory, non-threatening assessment. Someone in action may benefit from outcome-based assessment. So assessment is not a one-size-fits-all. It's more important to look at their readiness than be rigid in what you want. So the different phases of assessment, there's 4 major phases of assessment. So assessment selection, what is the appropriate assessment that we're going to use, administration, interpretation, and then communication of findings. So each phase builds on the previous one. Skipping steps or rushing the process is going to increase the likelihood of misinterpretation and ethical problems, so don't do that. All right, so first we have assessment selection. So that starts with knowing where to look, right? Knowing your client and their problem, and then knowing where to look for the assessment. So some resources for you for that is Griselli's library has access to mental measurements in yearbook, tests in print, and then you can always look at peer-reviewed journals because oftentimes they'll post the assessments in the back of that as like an appendix item. But locating specific assessments, you can contact the author of that, you can purchase them. But what's most important is that you are looking at evidence-based assessments, okay? So if a tool does not have evidence behind it, it's not involved in the clinical decision-making process. Evidence is not optional. Okay, so selection. Next, we have administration. So how an assessment is administered can shape the outcomes significantly. So expectancy effects, or the Rosenthal effect, is essentially the self-fulfilling prophecy. So in this situation, your subconscious expectations can bias the client's performance. Additionally, any stereotype, threat, or environmental conditions, they all influence performance, so that's something to look out for. So in order to maximize an optimal administration, you want to be sure to provide structure, review conditions to support their best performance, assess the conditions of the environment of the room, provide any necessary accommodations that you have to, and always standardize your assessment process, right? So standardization and appropriate accommodations, they're not about being rigid, they're about being fair to your clients. All right, next step is the interpretation and communication of findings, so next steps. So interpretation, considerations related to assessment interpretation. So it requires more than just reading the score when you interpret it. Is it a hand assessment that you had them complete by hand, and now you have to sit down and go through the assessment and score it yourself? Or is it a computer scoring assessment? So clinical judgment is going to integrate the test data, the client context, the culture, and the lived experience into your interpretation. And then computer-based assessment interpretations can assist you in that, but they're never going to replace your counseling reasoning, your clinical judgment here. All right, and then the communication of findings, I call it the post-game show. We've gone through all of the assessment, and now we're going to communicate the results. That itself is a clinical intervention. All right, we're going to check in with the client. How did you feel when you took this? We're going to explain the purpose. Just a reminder, this is what the purpose of the assessment was. We're going to review the findings collaboratively with them. We're going to integrate their lived experience into it, and then plan the next steps, right? And all of that, doing all of that together collaboratively, that's going to build their trust as you start the process off with them. So assessment is designed to empower your clients, never to intimidate them. So this is a collaborative, I feel like I could say this over and over, but it's a collaborative process with them to help them. So after you've done the initial assessment is going to continue throughout counseling, right? We want to monitor their progress and evaluate their counseling outcomes. So it's continuing throughout counseling. We have progress monitoring here, which helps determine whether the treatment is effective. Am I doing what I set out to do, right? And then we have outcome assessment, which helps answer whether meaningful change has occurred. So this isn't about perfection, it's about clinical responsibility to our client, right? So progress monitoring, feedback enhanced therapy, how is this going for you? And response to intervention determines, do we keep going this way or do we pivot? Do we come up with a different intervention? And then looking at outcome assessment, we could compare a score to a desired score in another group. We could compare a score to a particular criterion, and we could judge whether the baseline score has changed, right? And if it has changed, is that treatment failure? If we go below the baseline, whatever, right? And so those are different ways we can evaluate their progress. There are 4 useful tools, right, for evaluating progress in counseling. And so we often use satisfaction forms. We have the OQ45 here, self-report scales, self-monitoring, and of course, rating scales. And then also program evaluation plays a role, especially in agencies and system levels work, where we ask the client, how do you think the program's doing for you, right? So not specifically on them and their progress, but how are we doing in providing you a service to support you? So this is how counseling stays accountable to both the client and the profession. Right? All right, so to conclude, assessment is continuous and collaborative. I know, I keep saying that. Method choice depends on the purpose of the assessment and the client. Data and clinical judgment work together. Ethical assessment includes limits and bias, and progress monitoring guides your clinical decisions. So ultimately, everything in this chapter comes back to this idea of intentional decision making. So assessment is how we stay ethical, effective, and accountable. It makes our job easier also. As always, if you need anything from me, do not hesitate to reach out to me. My email is masmith@jcu.edu.